as at now, there's no specific treatment. Like when you say someone has this condition, this is what you give your shoulder is going to treat the COVID-19, or there's no vaccine.
Right, when it comes to COVID-19 and coronavirus, many people use these terms interchangeably. What's the difference between coronavirus and COVID-19?
Yes, COVID-19 is an airborne disease.
Can vinegar be used to kill COVID-19?
I mean, to be sincere, I don't know. Yeah. I haven't seen any scientific research on that, or there have been no scientific proof to tell us that vinegar will do that. But personally, I don't think so. Okay. That's why they say, as often as possible, you wash your hands under running water with soap. You use alcoholic hand rub or hand sanitizer to disinfect your hands whenever you greet people, even though you don't have to. Yeah. You don't have to greet anybody. If you are coughing, you cough in the flexed elbow, and most importantly, you stay home.
So I'm home today with Dr. Fred Fongang. He's a resident medical officer at SACS Healthcare Clinic. Welcome, Dr. Fred.
Thank you very much. It's nice. I'm happy to be here today.
I'm really glad you could join me for this conversation.
Thanks for having me.
All right. So our conversation today will be mainly focused on coronavirus. So Fred, to jump straight into our conversation, okay? So what's the distinction between a virus and a bacterium?
If you want to talk a little bit about how to differentiate a virus from a bacteria, mostly it's usually structurally. That's probably when viewed under a microscope or when cultured. Usually viruses are very tiny. I mean, very, very tiny under the microscope. And also, unlike bacteria, viruses usually replicate only inside living cells. Yeah, and also less than 1% of bacteria usually causes disease, but most viruses do cause disease, and usually they are very specific, like the organ they want to attack. For example, if you want to take talking about the COVID-19, that is a pandemic in the whole world right now. COVID-19 is very specific to the respiratory system. That's when the virus gets into contact with a human being, it goes directly, it targets the lungs, and that's when it causes all the havoc. And also, briefly, if you want to talk about treating, maybe one in terms of treatment differentiation. When you are treating a bacterial infection, mostly you use antibiotics, meaning that an antibiotic wouldn't work on any viral infection. And for most viral infections, you use antiviral, and an antiviral drug too wouldn't work on any bacterial infection. And also, without being exhaustive, I think those are some of the few points we can take on.
Okay. So now, right, when it comes to COVID-19 and coronavirus, many people use these terms interchangeably. What's the difference between coronavirus and COVID-19?
Okay. Before we talk about that, first of all, I have to know that coronavirus is not a new virus. It's a virus that has been with us. I think it was first discovered in 1930. And to be a little bit more recent, back in 2003, there was an outbreak in Asia where most of the patients had respiratory difficulties. And then the virus that was identified to cause those respiratory problems or the respiratory symptoms, difficulty in breathing, cough, sneezing, and all that, the virus that was responsible in causing that was named by the WHO SARS-CoV, that's severe acute respiratory syndrome coronavirus. That was in 2003. Okay. Also, that virus caused a lot of victims. But compared to what we're having now, it's a little bit different. The virus we have right now is more virulent and spreads way more than what happened in 2003. And that wasn't a pandemic, it was just an epidemic. Also in 2012, there were, in the Middle East, part of the population showing similar symptoms, and there was another virus too, which was also a coronavirus, which caused those problems, and that virus was named MERS-CoV, that's Middle East Respiratory Syndrome coronavirus. Now, coming back to what you were talking about, the COVID-19. COVID-19 is a novel strain of coronavirus, meaning it's still a coronavirus, it's just that it's a new strain that was discovered, and it was discovered in 2019, in November 2019. We started talking about COVID-19, about coronavirus or COVID-19 from November 2019, which was first discovered in Wuhan, in the Hubei province of China, and which has spread worldwide, and the WHO in February termed it a pandemic, and that's what the whole world is fighting right now.
Talking about the pandemic, what's a pandemic? Because I know many people are hearing the term pandemic, global pandemic. So what's a pandemic?
It's true. In public health, when you say a disease is a pandemic, it means mostly that the disease has gone through many continents or through a lot of countries and is affecting the various populations. Mostly to be very brief, that's what when we talk about pandemic disease, that's what it means.
Okay, thank you. Now this confusion out there. People are wondering, is COVID-19 an airborne disease?
Okay. To answer that question, first of all, we have to define what is termed an airborne disease. Yeah. And mostly, what we call an airborne disease is mostly, for example, if someone who has an infectious condition and the person has symptoms, the person is coughing or sneezing, and the condition is contagious. If the person coughs or sneezes and then you are in close contact with that person, usually you can inhale the respiratory droplets or the saliva droplet the person will cough out, and then you also get infected. So yes, COVID-19 is an airborne disease. And with that said, you know that COVID-19 is primarily transmitted through respiratory droplets or saliva droplets from an infected person, or even though now they say asymptomatic patients can transmit the disease, but mostly or primarily is transmitted through respiratory droplets. If someone maybe is about 1 meter close to someone who is positive of COVID-19, if the person coughs or sneezes, you inhale the respiratory droplets, then you can get infected. Also, someone coming into close contact with an infected patient can also get the disease. Or you coming into contact with a contaminated surface from a patient who tested positive of COVID-19, you can also have the symptoms. So usually that's how the virus is being spread.
So you mentioned asymptomatic, right? Yeah, it's kind of like, people who don't show symptoms of this, right? And I learned that those who don't show symptoms also, as you rightly said, can actually transmit this illness. Take us a little bit about that. How is that feasible?
Okay, like you said, when we talk about asymptomatic, it means that someone who has asymptomatic patient from COVID-19, it means that someone probably who has tested positive of COVID-19, but is not exhibiting any symptoms. That is not having any cough, any sneezing, or any difficulty in breathing, but still he has tested positive of COVID-19. But first of all, before we answer that, we have to understand that primarily COVID-19 is being transmitted. The major route of transmission mostly is from a symptomatic patient. That's someone who has tested positive of COVID-19 and is symptomatic, meaning the person is coughing, having running nose, difficulty in breathing, and all that, and you come into contact with the person, you can get infected. But also, someone who is asymptomatic and has tested positive of COVID-19, it means that the virus is replicating in the person's system. Remember, like I told you, viruses usually need living cells to be able to replicate. So the virus is replicating in the person. So you can create a case scenario where someone who is positive, maybe is not coughing or having any difficulty in breathing, but probably touches someone because on the surface of his body, maybe the mouth, the nose, the eyes, and probably greets you or touches a surface, it contaminates that surface, and you come into contact with that, you can also get contaminated with the condition.
So as you mentioned, right, that some of the symptoms of COVID-19 are coughing, sneezing, and difficulty in breathing, right? But now, some triggers also like dust, right, like spicy food, and even strong emotions can cause sneezing. So how do you distinguish between, how do you distinguish sneezing, that is a symptom of COVID-19, and sneezing that is just caused by this, some of these triggers?
All right. I mean, it's quite simple. I mean, but I'm sure it will be easy to understand.
Okay.
For example, if you are in an environment, a dusty environment,
Yeah.
and there are allergens. Allergens means that something that is causing you to react.
Okay.
So if you are in a dusty environment, and then your reaction to that environment is you're coughing, you're sneezing. So usually the solution to that is, if you leave that environment,
Yeah.
probably if here was a very dusty environment and I'm coughing and sneezing, once I leave this environment and probably go outside or leave from this area, you see that the symptoms are going to stop. I'm not going to have such symptoms again. Well, except if maybe I have a chronic condition like asthma, that if such allergen triggers my asthma, it might not go on to get some treatment. But if I don't have that, usually once you get out of the environment,
Yeah.
the symptom stops. However, with COVID-19,
Yeah.
this is a case where persistently you are coughing, you are sneezing, you might get other complications like difficulty in breathing, that you need to be put on oxygen or intubated. Or the worst case scenario, some people will die. I hope you understand the difference. Usually with COVID-19, you might actually need medical attention to get better. Whereas for the other case scenario you were talking about, once you leave the environment, you're fine.
Okay, you're talking about maybe somebody who has asthma. That takes me to another, some of the things I've also read, right?
Sure.
So, but I also read that those above 60 years of age and those with underlying health issues are more likely, right, to be infected with COVID-19. So tell me a little bit about that.
Okay. It's not that they are more likely, but it's that if they have the condition, usually the worst case scenarios usually happen in that age group. The reason being that the aged or such population usually have a lot of underlying medical conditions. There are some of them who usually have probably hypertension, diabetes, some have cancer, HIV/AIDS, and such conditions usually reduces the immune system of the person. And you have to understand, when we talk about the immune system, is like the defense mechanism of the body. So if your immune system is already low, and then the virus attacks your body, it becomes very difficult for your body or you to be able to fight such conditions. That's why usually such people are the ones who either die or have bad experiences. But we have to understand that with COVID-19, 80% of the population, even without medical attention, will get well.
Oh.
Yeah, that's the other part of the condition. And also, it's usually about 5 to 10% of the population will die. And in that 5 to 10%, about more than 90% of them are the aged. And we've explained why.
Yeah.
Yes. And 30% also are the asymptomatic patients. And asymptomatic patients are usually gotten from contact tracing. Let's say mostly there's someone that was tested positive for COVID-19 and probably was having symptoms. Contact tracing mostly means that you now go around and try to get the people that you think that patient came into contact with, and then you also test them. So usually once you do that, there are some people that will test positive, but such people are not having symptoms. They are exhibiting no symptoms at all, but they have the COVID-19, and usually about 30% of the people are in such categories.
Dr. Fred, yeah, a lot is going on, right? A lot of information is out there. But one of my friends resolved to using vinegar, So whenever she goes to buy food from the market, right, when she brings the food home, she resolves to use vinegar. Like she uses vinegar as one of the disinfectants. She believes, okay, she puts vinegar inside water and mixes it and washes her food with it. The food is actually cleared of COVID-19. So my question is, can vinegar be used to kill COVID-19?
I mean, to be sincere, I don't know.
Yeah.
I haven't seen any scientific research on that, or there have been no scientific proof to tell us that vinegar will do that. But personally, I don't think so. Personally, I don't think so. What has been proven by, and has been documented by WHO is using alcohol. I'm not talking about once you want to use to disinfect your food. I'm talking about disinfecting your hands or some hard surfaces in the house. You use alcohol, hand rub, or hand sanitizer, and most of the good ones are the ones who contain at least 70% alcohol, than 70% and above alcohol content. Such things usually will kill the virus, meaning that even if you didn't wash your hand under running water with soap and you just use a good hand sanitizer with the required alcoholic percentage, you should be able to kill the virus. Also, if you are cleaning your tables or whatever surface at home, if you use just alcohol, normal alcohol, you should be able to kill the virus.
Okay.
That's why they say as often as possible, you wash your hands under running water with soap. You use alcoholic hand rub or hand sanitizer to disinfect your hands whenever you greet people, even though you don't have to. You don't have to greet anybody. If you are coughing, you cough in the flexed elbow. And most importantly, you stay home. You go outside only if you need to or you want to go for an essential service. That's the only reason why you should go outside. These are not normal times, so you shouldn't just wake up and say you want to go and visit a friend just like that. You might go there and contract the virus, or you might not even know that you have the virus, and then you go and transmit it to others. Because like we said, you remember we said asymptomatic people. You might get the virus and get well, but you might transmit it to your grandfather or your daddy or your mommy or your uncle, and they might not have the immune system that you have, and they will perish from that. So protect yourself and protect others, because you remember the virus doesn't move. It's the human beings who move with the virus, and that's how come the people are affected. But if it actually happens that you really need to go and probably to go to the pharmacy, go to the supermarket to get some food items, it's imperative that you put on a face mask.
When talking about face masks, right, it's a little bit confusing, because when this whole stuff really became known to the world, right, it was actually said that face masks were advisable just for healthcare providers, right? But now it's like some countries have even made it like it's mandatory. If you want to go out of the house, you must put on a face mask. So
yeah, that's true. A country like Czech Republic, they published a documentary that, like for example, right now in that country, every citizen wears a face mask when he wants to go out. And whenever that law was passed in that country, they noticed that the cases dropped to the barest minimum. The propagation or the transmission of the virus really reduced, and they started understanding the importance of a face mask. Because whenever you wear a face mask, if for example you are sneezing or you are coughing, the face mask is stopping you from releasing the respiratory droplets that another person close to you will get the infection. So you are protecting yourself. That's if perhaps maybe you're not coughing, you wearing the face mask, you're protecting yourself from being infected by someone who is not wearing the face mask and is coughing. You understand? So once you wear a face mask, you're protecting yourself and you're also protecting the other people. In as much as even with all that, it's still good to practice the social distancing. That's being at least 1 to 2 meters away from each other, not shaking hands, and practicing all the other preventive measures that we talked about. But the face mask is very, very important.
So, all that said, we really want this thing to disappear. Please, is there any hope of is there any treatment coming up soon?
I mean, there are a lot of dilemma when it comes to the treatment. Like I said, nobody was waiting for this virus to come, and this particular strain was not in existence before. So many countries in the world have been affected, and the bad thing about the coronavirus, or what is making it so attention grabbing, is that once, in as much as it's been temporary, that's the pandemic, which is a very huge issue. Once the coronavirus gets into a country, it affects it cuts across board. So it doesn't just affect the health care of the population. It goes a long way to affect the religion, the social aspect, the political aspect, the economical aspect. You understand?
Sure.
And when it does so, it can even make a country crumble. If you notice now, there are so many people who have lost their jobs because some companies, their revenue has reduced. They might not be able to pay the people that they were able to pay before. So some companies that were having about 500 employees, they had to send home about 300. You understand? So you see the impact, and it's imperative that we all, in our own way, contribute to fight this virus. And then yes, as at now, there's no specific treatment. Like when you say someone has this condition, this is what you give, you're sure that it's going to treat the COVID-19, or there's no vaccine. But right now, there are so many researches out there, like the solidarity research, I think discovery research. There are so many research out there onto the treatment. But there's a professor in France, in Marseille, Professor Didier Raoult. He's like a legend in research. He has over 2,000 publications. Yes, so most of the time, those are people that you see up there, and when they say certain things, you have to take it with some outer of truth. So he came out with a protocol, even though it's being debated out there, but he came out with a protocol of treatment. As soon as the patient is diagnosed with COVID-19 and not very ill yet, you should start the patient on chloroquine and azithromycin. And I think recently he even released a clinical research, a clinical work he did on about 1,061 patients. It's true that the percentage that he brought was, I think, about 91 or 92%, which now is being very heated in the research world. They are saying that the percentage is very low. But whatever the case, if there is someone has come out with a protocol, you don't lose anything using it first, because if out of 10 people with that protocol you're able to save even 6 or 7, you've done a greater job instead of staying there without knowing what to do. But apart from that, mostly the treatment is symptomatic, meaning that if you're having a high fever, they give you something for the temperature. If you desaturate, that your saturation is low, they put you on oxygen. Worst case scenario, they intubate, put you on ventilators and all that. Mostly that's what is being done. But most countries have adopted the giving of the chloroquine and the azithromycin. I know in Cameroon is being done. Some other countries too have adopted that. But like I said, there's no specific treatment on it. Reason being why we should all make sure that we follow all the protocols given by the various countries and the WHO. You stay at home and go out on the evening.
So when I look at you, right, you're still this posed, you still make jokes around. So how do you succeed in being like this despite everything that is going around?
Oh, naturally, I'm a very positive person. I have a case job, With that being said, we the medical doctors, we saw an oath to always be there for our patients no matter what. So we still have to do our job. Now, we try as much as possible to respect all the preventive measures that have been put in place. Wearing the face mask and wearing the gloves and suiting up whenever you're going. It's like a battle. This is a war that we are fighting. In as much as there's these challenges with getting all the protective measures, all the doctors cannot get it. We are in a developing country, so it's quite challenging, but we are trying our best to stay healthy and to also protect ourselves when we can. But like I said, if majority of us stay at home and go out only when necessary, I'm sure, we'll be able to fight this disease. We are hopeful that very soon there might be some vaccine or a cure. This is a fight that we need everybody. We need everybody. In Africa, there are still some people who are thinking that coronavirus is a joke. So all of us need to contribute, because it doesn't take only the state or the government to make it work. It can be a personal decision. If you don't need to go out, you don't go out. Even if you have to stay at home for a month, at the end of the day, this is a war we're fighting. If we all come together, I'm sure we'll be able to defeat it.
Wow. Dr. Fred, thank you so much for making up time for this conversation. Believe me, I learned a lot from you. And please, our prayers go to you and all the healthcare providers out there that are actually fighting for us, ensuring that we are safe. Thank you so much. And Fred, thank you so much for
Thank you very much. But to conclude, the take-home message is the ultimate preventive measure is stay at home. Go out only if necessary. If you don't have to go out, stay at home. In addition to that, always make sure that if you wash your hands as frequently as possible. Whenever you are washing your hands, you do that for at least 20 seconds under running water with soap. You make sure you always use your hand sanitizer. You practice the social distancing, being about 1 to 2 meters away from each other. Stop the handshaking and the hugging and the kissing. If you have to cough, you cough in a flexed elbow, and always make sure that you wear your mask. If you really have to go out there to maybe to the pharmacy or to the supermarket or whatever, you make sure you put on your mask. And I'm sure if we practice most of this, we should be able to get rid of this virus in some weeks or so.
Thank you so much, Dr. Fred.
Thank you very much for it was nice being here, and thanks for having me.
Thank you so much for being here. Please, we're actually in Kumasi in Ghana, and Dr. Fred is actually Cameroonian, so he's my brother. So when we're out of our country, anybody from your country, it's your brother. So here we are. So Dr. Fred, thank you so much, and I'm really glad you could make our time here. So during this lockdown, I think it's a perfect time for you to learn something new. Before I knew it, my younger brother had read a book that has been lying home for over 6 months now. He used 1 week to read a book that consists of over 550 pages. Maybe there is a book also lying somewhere in your house. Now is the time you can try reading it. Maybe you wanted to learn how to draw. Why not? Try, learn it. There is something that you can do with your time now. Please don't forget. After this period, some people might just have become better. And if you're not careful, you'll be left behind. Please don't be one of those who will be left behind. Thank you so much for always being with us on the Shirley Show. And please, for more updates on the coronavirus or things you might want to do within this time, please check out our Instagram page or our Facebook page or our YouTube channel too for more updates. If you've not yet subscribed to our channel, now is the perfect time to subscribe. Like our videos and leave your comments.